and welcome to Prevent Blindness's Focus on Eye Health Expert Series. I'm Jeff Todd, President and CEO at Prevent Blindness. Joining me today is Dr. Janine Austin Clayton, Director of the Office of Research on Women's Health at the National Institutes of Health. Thanks for joining us, Dr. Clayton.
I'm really happy to be here.
Great. Could you tell us a little bit about yourself and your areas of expertise?
Absolutely. So I'm the NIH Associate Director for Research on Women's Health, and I lead an office on research on women's health at NIH. I'm an ophthalmologist by training, actually still see patients a little bit, and have really been dedicated to women's eye health for many, many years of my career. I'm also delighted to be now on the board of directors of the American Association for the Advancement of Science, which gives me another pathway to support science and how science solves society's problems.
Wow, what a diverse background. So April is Women's Eye Health and Safety Awareness Month at Prevent Blindness. As an ophthalmologist and a researcher on women's health, can you explain to us why it's so important for women to make their eye health a priority?
Sure. Vision is such an important sense, and it's so valued by all of us. It affects our quality of life, our ability to do work, our recreation. It can affect everything. And we know that, unfortunately, women are disproportionately affected by blindness and vision impairment. So many eye diseases affect women more than men. And so we see more women, for example, with age-related macular degeneration, one of the leading causes of blindness, more women with glaucoma, and those are diseases and conditions that can be detected from an eye exam. So it's really important that women and everyone knows that they need to get an eye exam so that we can see if they're developing an eye problem, which may cause no symptoms whatsoever in the beginning, because we can treat and sometimes prevent disease by getting our eyes examined. So because women are disproportionately affected, we want to make sure that women know that it's important for them to take care of their own eye health and get their eyes examined.
So Dr. Clayton, why is it that more women than men have eye disease and vision loss?
Great question. So actually, women are 1.5 times more likely to be blind or visually impaired than men are. And that's worldwide, Jeff, even in the United States. And age is a risk factor. We know women tend to live longer than men. They unfortunately live more years with disability. And age is a risk factor for many, many eye diseases, but that doesn't explain it all. We know there are sex differences, biological differences, for example, immune system differences that account for some of it. And we know there are gender differences in terms of social, gender as a social construct and attitudes. But the real answer, Jeff, is we don't have the answers. And that's why we need more research to be able to find those answers. We do that research at the National Eye Institute, one of 27 institutes and centers at NIH. And I spent many, many years as a part of the National Eye Institute, and it's my privilege to do this work at NIH.
So are there ways that people can connect to NIH to learn more and to stay in touch with all the great work going on there?
We do encourage folks to follow us on social media, the NIH Office of Research on Women's Health. Check out our website, nih.gov/women, and follow us on social media, as well as the National Eye Institute. And recently I had the opportunity to work with an amazing group of women scientists and clinicians sponsored by the Society for Women's Health Research. And we created a new publication that's out in the journal Biology of Sex Differences that summarizes how sex and gender affect eye health and result in disparities in eye health for women. So if you want to get more into the nitty-gritty, check out that paper. And you can access a toolkit that the Society for Women's Health Research created, and it includes content for women on how to ask these questions to your eye care provider at the Society for Women's Health Research and their website.
Thank you for mentioning that, Dr. Clayton. And Prevent Blindness was very proud to be a part of some of the work that the Society for Women's Health Research did related to eye health. So women are often viewed as the caretaker of the family. Do you think this emphasis that society puts on that role contributes to women taking less care of their eyes, unfortunately, than men? Or frankly, of their health in general?
Great question, Jeff. We do know that women do take disproportionate efforts in terms of caregiving, both for children and older adults in their family and for individuals when they, and what that can do is take women away from taking care of themselves. You're absolutely right. And women do tend to, in general, put themselves last on that list. And one of the things that we do always want to make women aware of, and everyone aware of, is how important it is for caregivers to take care of themselves, not just because they can't care for others if they're not healthy themselves. You know what they say when you fly on the airplane, you know, if we lose cabin pressure, put your oxygen mask on first so you can help other people, but just because everyone deserves to have the best care for their own health as individuals. And, you know, women make 70 to 80% of health decisions in this country. And so that decision to get care, we want them to make that decision too, to take care of themselves.
Great. So, you know, here at Prevent Blindness, we're very aware that too often there's a disconnect between our eye health and the rest of our health for various reasons. But we also know that an eye exam can tell us a lot about overall health. Could you talk a little bit about that?
Sure. I'm sure you've heard that saying, the eyes are the windows to the soul, but literally the eyes are the windows to your body. We can see so much of your body. We can literally look at a blood vessel when we're looking in your eye. And I don't know if you know this, but your eye develops out of your brain. The eye is really part of the brain. So that's pretty amazing. We can actually diagnose hypertension or high blood pressure by looking at the blood vessels in your eye. We can see signs of diabetes or elevated blood sugar by looking at your eye. We can see signs that are associated with brain tumors by looking in your eye. So there are a lot of different conditions that affect the body that we can actually detect by looking at your eyes. And that's pretty incredible. One of the exciting things about ophthalmology is that, you know, we're not just taking care of eye health, we're taking care of your overall health.
Absolutely. Thank you for sharing that. So is there a particular age in a woman's life when you would recommend that they get a baseline eye exam? We talk a lot about the importance of routine eye care, but is there a particular point where it's really urgent for that?
In general, the American Academy of Ophthalmology recommends that a woman gets at least one eye exam in her 20s, two eye exams somewhere in her 30s, and then everybody should get an eye exam when they turn 40. And of course, this is just a rule of thumb, a general baseline rule of thumb. If you wear contact lenses, you need to have an eye exam yearly. If you have any medical conditions like diabetes or high blood pressure, you need to follow your primary care doctor's recommendations for how frequently you need to have an eye exam. If you have a family history of eye problems, you need to go more often. And so that's just a general rule of thumb. I always tell folks that you really know your body your best. So if you think something isn't quite right, you're starting to see halos around lights when you're driving at night, if you feel like something's in your eye or your eyes are scratchy or itchy or burning more often than normal, and you know that you don't have allergies and you can't attribute it to something else, just if anything is not quite right. And Jeff, one of the things with vision is because we have two eyes, we could, it's common that people may not realize they're losing vision in one of their eyes. And so we ask folks to just cover one eye, cover the other eye, and just make sure your vision is good in both eyes. And we're not just talking about up close vision, but your peripheral vision as well, because that's what we know gets affected with glaucoma. So the best way to really have folks be sure that their eyes are okay is to be attentive to their own vision, but also to leave that to the professionals and come in and get that checked out by an eye care provider who can measure your vision and make sure that nothing's going wrong.
Got it. Got it. So specific to women, are there potential impacts to vision that may occur during pregnancy or menopause?
That's a great question. So one of the things that can happen during pregnancy, your blood volume, the amount of blood that you have in your body actually increases. Your blood pressure increases slightly. And there are conditions that are associated with elevated blood pressure, conditions called preeclampsia, where they can actually affect the back of the eye. And so that because of the high blood pressure, that causes a problem in the eye. Also, because of the fluid, the increase in fluid that we have, every pregnant woman will tell you, your feet swell, there's just more fluid around. That can affect the cornea, which is like your crystal on your watch. It's like that clear dome that's in the front of the eye. It can actually swell. And what happens with that is that can change your prescription for your glasses. So those glasses that you're wearing or your contact lenses before pregnancy might all of a sudden not be quite right. And we can adjust that. It's a temporary situation. Some women develop what's called gestational diabetes or elevated blood sugar just during pregnancy. And that can cause problems in the eye. It can actually even result in diabetic retinopathy, signs that we see in the retina, the back part of the eye, related to that high blood sugar. So there are several things that can happen in the eye just during pregnancy. What about menopause? During menopause, many of the hormones that women produce during their lifetime decrease. And as a result of that, what we see is an increased incidence, new diagnoses of dry eye syndrome. And dry eye is much more common in women than in men, at least twice as common in women than in men. Women tend to get diagnosed at younger ages than men do and tend to have more severe symptoms. And I do have to say that dry eye is one of those things that is just more than what it sounds like. It just sounds like, oh, it's just a little dry. That's not a big deal. Well, unfortunately, when the surface of your eye is dry, your vision gets blurry. It's not it's like looking through a window that has smudges on it. And when you blink, it changes. So it's really can be maddening and can affect your ability to work on a computer or read for long periods of time. And that increases at menopause.
Yeah, I think we hear too often, they have dry eye, they can just take drops and everything will be fine. I know it's much more complex than that. Well, and speaking of complexity, I'm certainly learning that women's bodies seem to be much more complex than us men.
There are differences. There are differences we
right.
need to account for it. That's all. We just need to account for their differences so that everybody can get the best care that they need.
Absolutely. So what about cosmetics? What should women or men, for that matter, know about how cosmetics may impact eye health?
I'm glad you mentioned this is an issue for everyone because more and more we know people put lots of cosmetics on their face and especially around the eyes. The skin around your eyes is the thinnest skin in your body. It is extremely delicate, and creams and eyelash serums and eyeliner and any kind of, even sunscreen that you put on your face, it can affect your eyelid skin and your eyes. It can make dry eye symptoms worse. And certainly you don't want it to get in your eye. And so one of the things that's important to remember is to pay attention to what's in those creams and cosmetics. They are regulated differently than medications are. And so that's important for every consumer to know. The other thing is I tell folks, lots of people wear eyeliner and mascara is you really need to throw those away after 3 months. Bacteria can get into those cosmetics and then you can develop an eye infection just because you're putting this around your eye. So that's an excuse for you to go buy some different cosmetics every 3 months. So that's an important issue, I think, for everyone.
Great. So do you have recommendations for women on how they can be prepared to talk to their eye doctors and be more engaged in their own eye health?
Something I tell everyone in my family or anyone who asks me is that you're the expert for your body and you are your own best advocate for your health. And it's really important that everyone is empowered to do that, but particularly women, because we know historically that women's symptoms are often dismissed. So if you know something's not right, you need to insist that your provider address it. And if that provider does not address it, you need to seek another provider. And so one of the ways to help everybody do that, and something I do myself, is make notes before you go to the provider on what is bothering you, what doesn't seem right. Most of us have a phone with us everywhere we go. And so I just put mine in my iPhone so that I remember to look at it and I can find that piece of, instead of trying to find a little piece of paper that I wrote it on. But whatever works for you is write down what your symptoms are, what you're worried about, and what your questions are. It's easy to get in the doctor's office and forget, I really wanted to ask about, why I'm seeing like this. Any of us, that can happen to any of us, me included. So I just write it down and then ask questions at the, before you leave the provider's office. Make sure your questions get answered. And if they're not answered, then make a note of that and look for somebody to care for you who you feel is listening to what you have to say and gives you the treatment that you feel that you deserve. As certainly everyone deserves high quality medical care. And we also say that everyone deserves care that is sex and gender informed. By that, I mean, we need to understand that, women are more likely to have dry eye disease. So a clinician must be looking for that in women. Women wear more contacts than men do, and contact lenses themselves can cause dry eye. And so somebody who's attuned to those sex and gender differences is a provider that can give better care, higher quality care, and more rigorous care. So at NIH, we have created sex and gender based coursework that's available online for anyone who wants to take that, not just for eye disease, but for any disease.
I think that's so important for all of us to be able to connect with a provider that we can relate to and relates to us. It's such an important part of healthcare. So we know that women, and unfortunately women of color especially, often lack access to quality eye care. Do you have thoughts on ways that we can address these inequities and break down barriers to care?
I certainly believe that every person has a right to high quality health care. And we need to, as a society, as a country, ensure that everyone has access. So whether that's through a federally qualified health center, whether that's through state-based assistance like Medicaid or other services, private insurance, work-related insurance, we need to ensure that everyone has access to health care. Health is the ultimate commodity, and we can't all live our best lives, reach our full potential, have the most economic impact on our society, care for our families, produce, products and goods and services without our best health. So I think health is one of those things that should be everybody's business. We all need to work to make sure that everybody can get that care, whether that's through policies that need to be changed or just making sure in your workplace that you make space for people to go to their health appointments, or paying attention to the importance of wellness, whether that makes, making sure that people have time for their breaks or making space in your workspace. That's something that we've done, is just making a little wellness room for anybody to go and sit for 15 minutes or whatever they need. And recognizing that mental health is part of overall health. So those are just some of the things that are on my mind about ways to ensure everybody gets optimal health. And you mentioned, of course, the important issue of health disparities. We know too often in this country that everyone does not get high quality care, and that women of color in particular, from racial and ethnic minority groups, have not always gotten high quality care. And that's something we want to see change. We want everyone to get the best care because everyone deserves the best care.
Absolutely. I'd like to touch on, you mentioned mental health briefly. At Prevent Blindness, we get a lot of calls and emails and definitely recognize that individuals experience fear, depression, and anxiety when they're dealing with vision loss or the potential of vision loss. What steps can patients and caregivers take to help address some of these concerns? And, I'll tell you a quick story. My own grandmother had macular degeneration, and I watched, as a young man, I watched her depression basically take her life. And so I connect that with the eye care. And I think too often we say that, well, you don't die from vision problems. But I personally know that, there's a connection there. So I'd love your take on how we can address those mental health challenges.
Yeah. You know, you're touching on something that is so important, and mental health is part of our overall health, and it needs to be considered as part of health. And you're absolutely right. Losing vision, being in chronic pain from dry eye disease, for example, needing chronic care, having multiple surgeries, needing to take multiple medications, all of those can take a toll on our mental health and cause anxiety and depression. So I think the number one thing that any of us can do is to listen when somebody says that they don't feel up to par, that they may not use this word, I feel depressed, but you may notice that they're just not doing the things that they normally do. And we know for older people, thanks for sharing that story, Jeff, that for older people in particular, social interactions are critical to their health, their mental health, their overall health. So if you can't see the cards to play bridge, or you can't drive anymore and you lose independence, or you can't even see on the computer to, engage in your monthly FaceTime or monthly, video chat with your family, that can affect health. And so what we want to do, first of all, is recognize it in a non-judgmental way and just ask somebody how they're doing. I think that's the first step and even if a person doesn't want to talk about that, being gentle about offering opportunities for them to talk to somebody else or to perhaps see their provider without disrespecting their independence, and their autonomy. These are personal choices that each individual needs to make for themselves, but we want to support everyone because we know that mental health and mental illness is still stigmatized in this country. And, what I usually tell people about mental health is there is no way if you broke your arm that you would not just say, I'm not going to get a cast on. I'm just going to, grin and bear it. I'm just going to not get a cast. You would never do that, right? It's the same thing. If something's just not right in our brain, and mental health is caused by problems in our brain, it may be related to response to trauma and things that are happening in our life, but we have things that we can do to assist you. And there is no shame in it. It is not about character. It is just about illness and disability that we can address so that everybody can have their best quality of life. It's, optimal health is what we're aiming for, Jeff, and at any given part of our lives, that means different things. And it means different things to different people. So asking somebody what's important to them. Also, when you lose vision, there are some adaptive devices and assistive technologies that we can put in place, things that will dictate things on your computer screen, or magnifiers, or even little telescopes that we can see that can give people independence, adjusting the settings in your home so that you can navigate that space better. There are many, many things that we can do to make your life easier if anybody unfortunately loses vision. And we want to make sure that people know that we're here to help. There are organizations like yourself, the National Eye Institute, the eye care providers that have information. And we want you to ask us if something doesn't seem right. And we want to put you in touch with folks that can help you.
Yeah, and you touched on independence. That's so important. We all want to be independent. I think it's part of being human. We want to be able to take care of ourselves, and I think that's one of the biggest challenges people have who are addressing vision loss. And thank you for recognizing Prevent Blindness. We do have a resource called Living Well with Low Vision that people can access that provides all sorts of tools. So thank you again for joining us today. I'd like to ask one last question as we wrap up. Health and eye health is a lifelong thing. What can women, particularly younger women, what steps can they take today to help protect their vision in the future?
Now, that's a great question. We're talking about this because women are 1.5 times more likely to be blind or visually impaired than men are. And first step is awareness. And so efforts like this help get the word out about this higher risk for women. And research is needed because we don't know exactly why, but what steps can everybody take? First of all, it's amazing that the things that are healthy for your heart are also healthy for your eye. It's incredible. But so dark leafy vegetables that have two things, these lutein and zeaxanthin. So you know that those greens are good for you. Just didn't know they were good for your eyes too. Fruits and vegetables that are high in vitamin C, like orange juice. Orange juice has a lot of sugar in it, but fruits and vegetables that are high in vitamin C can help reduce the risk of cataract, delay that, and slow AMD progression. Cold water fish like tuna and salmon at the prescribed amount of frequency for you, because fish does have mercury in it. So two times per week is often the baseline recommendation. And then zinc is something that's really important for your eye health, and eggs and whole grains have zinc. So a healthy diet, exercise, so that's also will help you maintain a healthy blood pressure, and blood pressure can damage your eyes as well. Protecting your eyes from the UV rays that come from the sun. So wearing sunglasses is not just a fashion statement. You're actually protecting your eyes and delaying cataract formation, for example, and protecting your retina. If you're doing anything, working with any chemicals, whether it's a drain cleaner or paint, wear eye protection. When you are engaging in high impact sports, or your family members are, make sure they're wearing eye protection. Throwing away that cosmetics after 3 months of use, just making sure you minimize your risk for infection. So safety goggles, protective eyewear are some of the things that we can do. If you wear contact lenses, see an eye care provider once a year. Don't engage in, cosmetic contact lenses that you buy somewhere without a reputable, vendor or prescription. Take your eye health as seriously as you would any other part of your body. So that's really important. And then for all of us who are working more on our computers every day, who have the privilege of working from home, we need to rest our eyes. When you're working at a computer, you're focusing, you're using those eye muscles that focus up close. So you want to rest your eyes. And we have this 20-20-20 rule, which is we recommend you take a break every 20 minutes and look at something 20 feet away, so far distance, and for 20 seconds to rest those eye muscles, because they do get fatigued. The other thing that happens when you look in the computer a lot is your eyes dry out because you don't blink as much when you're concentrating. Or if you look at a movie or something like that, even sports events. So protecting your eyes by just being aware of that and blinking, take a little blink break, walk around. It's not good to be sitting all that time either. So those are some of the things that any of us can take to try to protect our eyes and maximize our eye health for a lifetime.
Thank you so much. And I really appreciate this conversation. I think this is going to be very useful information. So thanks for joining us today, Dr. Clayton.
So excited to be here, Jeff. Thanks so much for inviting me.